Okay, hi, and thanks, Richard. So yes, I'm Coreen. I am the Support Development Officer at the Brittle Bone Society in the UK. To confirm, I'm not a dentist. So go easy on me. I'm here to talk about the perceived dental care needs, and we developed a survey in conjunction with some of my colleagues here on the left-hand side, and the dentists are currently in the process of writing up the paper. So this is just very initial analysis. So why did we do this? We know the types of dental disease is variable. There are no UK-wide standard guidelines for dental care for individuals with OI. So the first step we thought was to understand what the needs of people living with OI are, and then secondly to develop a standard for diagnosis and management of dental disease. So the objectives: dental concerns, we know they're common for people living with OI, and up to 50%, depending on the type, are thought to have DI. There's limited evidence regarding the standard of care. So to investigate the current issues and care experiences from the perspective of those living with OI, the Brittle Bone Society designed this survey in conjunction with the Medical Advisory Board. So we covered three themes: dental problems, dental concerns, and accessing care. So just some demographics. The survey, we had 110 respondents, 21% were 16 and over, 79% were adults, 70% reported having dental problems related to their OI, and 44% stated they had DI, with 29% unsure if they had DI or not. Some more stats. 68% reported having concerns with the appearance of their teeth, 44% had issues with their bite, and 23% reported experiencing having dental pain, and 18% had pain in their jaw. Obviously, I've pulled out these two stats in particular. So reasons for dental pain: dental decay. Severity of pain generally depends on the extent of the decay. Other reasons: gum disease, trauma to the teeth, and infections secondary to any of the previous. So this stat, I have to say, really surprised me. Apparently, the general population report, between 30 and 50% of the general population report having dental pain. In our survey, there was only 23% of people with OI reported having dental pain. Be interested to hear if there's any thoughts on that. Reasons for jaw pain, usually related to TMJ. Other rarer reasons could be cysts, infections, or impacted teeth. And in comparison to the dental pain, general population, 10% report having jaw pain, not dental pain, and 18% of the OI population reported having jaw pain. So with jaw pain, it's higher in the OI population than in the general population. Other areas that we covered: dental concerns, so things like access and funding, checkups, extractions. As you can see from the pie chart, so the green area, the extractions and the checkups were an area of concern for people who were struggling to get access to checkups and extractions. And access and care, red part there, people reporting that they're trying to access care. The main issue was lack of experience from their dentists, or they just didn't feel, the dentist didn't feel comfortable treating them. The other big area highlighted was dentists not wanting to treat them because of current bisphosphonate treatment that they were on. Conclusions: dentists need to be more aware of the effects of both DI and effects of bisphosphonates in relation to treatment to improve care. Further research is needed into looking at both genotype and phenotypes, and we need a better understanding of pain, periodontal issues, and other dental anomalies. Thank you. That's my very quick 5-minute overview.
Thank you, Coreen.